Hey, thanks so much for joining us. Today, we're talking about spine care with Dr. Don Turner. He is a neurosurgeon with Front Range Center for Brain and Spine Surgery. Dr. Turner, thanks for taking the time to chat with us.
Well, thanks for having me.
So I'd love to start with this. What are the most common types of issues that you see that lead to spine surgery?
Well, pretty much areas of the low back called lumbar or your neck called cervical, basically ruptured discs, narrowing of the spine, sometimes instability of the spine, basically pain issues and neurologic issues related to the spine.
What are some of the different treatment options for those types of problems?
Well, there's conservative treatment first that somebody else may order, or sometimes we order, it depends. But there's physical therapy, there's injections like epidural steroids and things like that. But if somebody really needs surgery, then there's different types in different regions, but the most common things are either disc ruptures, pain in the legs, sciatica. We do ruptured discs in the low back. We occasionally do fusions. In the neck, we do ruptured discs. We do fusions and artificial disc replacements. There are some lumbar disc replacements available, but they're not done nearly as frequently.
When you're doing these types of surgeries, what can people expect as far as how long they're under? Do they get to go home after? Different things like that.
Well, I probably do 95+% of my surgeries as outpatients. So most of the surgeries are going to be an hour or less, at the most 2 hours. People are going to be in the recovery room for anywhere from 1 to 3 hours, say, and then they'll go home, even if it's a long distance. We have a lot of patients from Nebraska and Wyoming and so on, and they'd still rather go home than stay in the hospital. And frankly, I think it's probably safer.
What can you expect if you go under and then you're an outpatient, you get to go home? What do those next few days look like?
Well, you're going to be sore depending on the kind of incision and where it's made. For example, in the low back, if you make an incision in the back, you're going to cut some muscle and people are going to be sore. But in the neck, sometimes a lot of the time we go in from the front right here, and that isn't painful here. It just hurts a little bit in the back because of the devices we put in. So people handle it pretty well. We send them home usually with some pain pills, some muscle relaxants. We want them up and around. They can eat whatever they want. Most people think it's better that way.
Yeah, it's really amazing to me that you can perform these procedures in such a short amount of time and then get people back home that quickly. Really interesting to learn about this with you. Thank you, Dr. Turner.
Oh, you're welcome.
And we appreciate you watching. We'll see you next time.